Hi guys, it's me, Dr. Zina. I am a dentist, and today I'm going to talk about a different subject, which is a very challenging issue that a lot of people they suffer from, but they wait until they go like really, they have it hidden, this is a problem, and they don't really come up with, which is the sensitive teeth. If you have ever experienced an unpleasant sense or pain, whether you're drinking a sip of coffee or eating an ice cream, when you don't know what's going on, you just feel a sharp sensation in your teeth, you definitely have a sensitive teeth. I want to introduce you to the structure of tooth, and I want to know what is the reason why sensitive teeth happen. Why do I have this sensitivity, and what are the causes? How can I find the solution for my problem? Don't wait until you get really in. If we can have it at the beginning so we can cure it before it getting worse, so then we will have to do another treatment. So once you have the feeling, just please go see your dentist as fast as you can to know what's going on, what's the problem, then we find the solution. Now, what are the parts of the teeth? I am going to explain a very important one. I wish everyone who's watching really get the benefit of this, because we need to source out the problem. So the tooth is made up of, this is a molar tooth, as I explained previously, which is in the posterior part of your, the back part of your mouth. This is called the molars. Each tooth is made up of 3 layers. The first layer, which is the strongest layer in your body. This layer, it's called the enamel. Enamel is really, really strong, and it to protect your tooth from all the plaque, all the germs, all the problems that might be associated with your teeth. Enamel is very strong. Then the second layer, which is not really as strong as it in the animal, which is, we call it the dentin. The second layer is called the dentin. Then I have in the middle, or the third layer, this is the dentin supposed to be in here, and this is the pulp. The pulp is where all the blood vessels and the nerves are located for vitality of your teeth. So when I have damage in the enamel, the dentin is going to be exposed. And the dentin has, this is, let me draw so you can know what I'm talking about. Here are the blood vessels and the nerves. So they are here to keep your tooth alive. We need the blood. So there is a blood inside your teeth, and there is nerve inside your teeth. Now, this layer, which is the dentin, it has something called dentinal tubules. These dentinal tubules are full of nerve endings. Since the nerve is inside the pulp, they radiate and they have endings in the dentin layer, which is the second layer of the tooth. For any reason, if any damage happens in the enamel, if you break the enamel, you are starting, if it's a little bit, you start to feel sensitivity. Once it gets to the dentin part, if you have damaged this part, the dentin is exposed, and this when you start to feel the sensitivity. The dentin is not strong as it is an animal, so plaque and bacteria can invade it very easily, and this sensitivity, it might cause to a dental cavity or caries. Now, that's the structure of the teeth. The enamel is in the upper part of the tooth, which is this part of the tooth. I call it the crown. The part of the teeth that is visible outside your body, outside your mouth. Inside, this is the gum line. This part, the lower part of the teeth, is called the root. The root should be all covered by bones and gum, which is, we call it the gingiva. It's all covered. And this part, the enamel in the upper part, and in this part we call it the cementum. So the enamel, which is the outer part of the tooth in the crown section, and the cementum, the outer layer of that protect the root section. So I have two protective layers. The top one, which is enamel, and underneath in the root one, and underneath the gingival line, it's the cementum. For any reason, if the enamel or cementum worn or had any problem, you will have exposed your dentin, then you have sensitive teeth. What causes this enamel to be worn? I have so many causes. The first thing, when you eat too much citric food or citric drinks. Like what? Lemon, pop drinks, all the acidic food, pop drinks which contains carbonate, all these, they are responsible of tearing and dissolving the minerals of your enamel. In this case, your dentin is going to be exposed. That's the first reason. So you have to make sure what kind of food you're eating to make sure you have a healthier enamel. The second reason, if you have an old filling and you didn't check for a while, let's say some people, they don't check on their teeth for 5 years, 7 years, so the filling is being worn, so the underlining of the filling, it might cause a worn and causes sensitive teeth. If you have a lot of stress, so maybe you have something called bruxism. What the bruxism means? If you're stressed, maybe some of your family might feel it, you don't feel it, but if you sleep and you chew very strongly on your teeth, that's when you have too much stress. So this chewing and grinding on your teeth, which is called the bruxism, is good enough in wearing all the enamel, this part. It's going to be damaged. So the dentin is going to be exposed. I will tell you the solution for this, but please stop stressing yourself because you're the only one who's going to be in trouble. Keep on stressing and thinking, you're damaging your health, and you keep on feeling the same negative feelings whenever you think about it. Just stay healthy. The tooth decay, if you have cavities, you start to feel the sensitivity. The bacteria, the colony that I already explained about, they started to break down the structure of your enamel by releasing acid. And you're feeding this bacteria with remnants of sugar. If you're eating sticky substances, sticky food, too much sugar, chocolate, it's the perfect food for the bacteria to grow. Then they will start to release this acid that can dissolve the enamel. So it means it's a very first indication that you start to have a cavity. You don't have to go through a lot of pain and you don't sleep at night until you go to the doctor. So once you feel the sensitivity, you have to check, maybe it's a cavity and you need to stop it before it proceeds to go through the dentinal tubules and go penetrate till the root. So that's the second reason. The fifth, I guess I am the fifth now. The fifth reason for having sensitive teeth is when you have a receded gingiva. What is this? Receded gingiva, as you can see, gingiva is covering this part of your tooth, which is the root. When you use a very strong toothbrush, their bristles are hard. And if you brush your teeth, not in 45 degree that I've explained previously, if you just keep on brushing front and back, you are damaging your enamel root, your gingiva, and then you will have a receded gingiva. So in order, the gingiva has to protect this part. When you brush in this way, I'm explaining on the back teeth, but it's the same concept for the front teeth as well. So this gingiva, it can recede, come a little bit down. So I have more exposed cementum. You keep on brushing this way, you're tearing the cementum, which can protect the root. Now, whenever air comes in, any cold, any ice, any hot, anything, even sweet, you will have the unpleasant sensation. It means your roots are exposed and you have a gingival recession. So these are the most common reasons for sensitive teeth. I need to find the solution now. Once I have to localize the problem, I will go through each problem one more time. I already explained it. I'm going to give you the cure. The first problem, if you have a tooth decay. If you have a tooth decay, right away, if it's even a tiny spot of decay started or plaque start to form, you have to see your dentist to remove this damaged part when the bacteria is invading and replace it by filling, which is, it's really helpful. That's the first reason, it's the first thing. Number two, if you have a fractured tooth, you fall down, you broke a tooth, then I have exposed the dent into the air. So I need to take care of it and I need to seal it as fast as I can. So I will go to the doctor. They will do something called whether crown or inlay. What does that mean? We are going to reduce the size of your tooth. Then we take an impression. Maybe a lot of you have experienced this. It's just like a Play-Doh substance, but it's not really, doesn't taste good. Some of them, they just keep on, we have gagging reflex, we don't like this. Plus, there are special techniques we can use in the dental practice that stops you from having this gag reflex. We will have an impression, then we will send it to the lab. We are going to get an artificial tooth that can be placed inside of the fractured tooth. That's if you have a fractured teeth. If you have old filling, definitely you should replace it with a new one and a healthy one. If you are stressed and you have the bruxism that can tear your or worn your enamel away, you can wear something called the night guard. Night guard, if you couldn't control your feeling, if you couldn't stop being stressed, we have a solution for that. I want you to help your best to stop stress yourself, but if you couldn't, we have the night guard, which is a guard that's made up of kind of plastic. We do it that suits your teeth, same shape, and then you have to insert it on your teeth. It's just a protective plastic layer to protect your teeth from the bruxism. When you have gingival recession that I've already explained, your gingiva is getting down and down and exposing more of the root. This is a problem. By the way, most of the sensitive teeth, it happens between young age people, between 25 to 30. Because they try to take good care and they care about their oral hygiene, but the way of brushing is wrong. That's why they have gingival recession. We have a lot of people in young age, they have gingival recession. That's when the gingiva in the upper part or the lower part of your teeth, they're just recede. We need to reestablish, reattach the gingiva in its position. How can we do this? If it's severe, in this case we need surgical. We have to treat it surgically. We can reattach the gingiva to its place in surgery. Or you just maybe, if you just change your habit, if you learn how to really take care of your teeth and how to brush your teeth, they can be healed by themselves. Just stop giving too much irritation for your gingiva. That's the problems and the solution in dental office. Now, if I want to talk about things you can do to get you an immediate relief or something it can give you long time relief. For long time relief, I talked about using a hard bristles of a toothbrush. I want you to get the soft one, especially when you have gum infection, especially when you have sensitivity. So imagine you already damaged your enamel and you have a strong toothbrush that can brush aggressively, it will make it even worse. So we need to use soft bristles. It's written soft, like when you go to buy a toothbrush, it's written at the top what is the type of the bristle that it has. It has to be soft. That's the first thing you can do. Number two, you should get a toothpaste that's for desensitizing toothpaste or for sensitive teeth. The desensitizing toothpaste, don't use the brush if you're like really sensitive and like annoyed by the sensitivity that you have. Get the gel or the paste on your fingertip and massage the part of your tooth that has been paining you or annoying you for a while. Just massage, don't use the toothbrush for 2 days. I don't want you to stop, but you should definitely keep on using the floss and the gargling. So you keep on massaging the tooth. This toothpaste has a chemical that can change the pH of the solution. Saliva is pH because it has a plaque. That's if you have a problem. Of course, normal people, they should have normal saliva. But if it's acidic, especially on the affected place, you can use this toothpaste that contains a substance, a chemical, that change the pH to more alkaline. So it can be regenerate or strengthen your teeth. Plus, you can use a fluoride gel. Fluoride gel, you can find it in stores, or you can go in dental practice, the dental office, we have it. Use the gel, you place it, the gel is a fluoride, made up of fluoride. It can be made of chloride as well, or a fluoride, or carbonate. So here I'm doing the garlic toothpaste. If you can chew it, it's cool because it's going to produce the compound that is called allicin that has the antimicrobial effect that can kill germs. If you don't feel like you chew it because you're not really satisfied with the taste, you just can get 2 cloves of garlic, chop them, put 2 or 3 drops of water, just a little bit of water, and get some salt. Salt is sealed. Put some salt on it. Just cheer them all together. You can have a paste. It came up like a paste. You can use this paste. You place it on the place that you feel the sensitivity feeling on, and keep it for a while. This is gonna help you a lot. Then rinse with water after a while. I wish it was beneficial for you, today's episode, and I really wish you never have any unpleasant feeling in your teeth. I want you to stay healthy and stay tuned for the upcoming episode. I'm gonna talk about another topic. Thanks for watching.